Hey everyone, welcome back to another video. In today's video, we're going to explore a common cause of shoulder pain and restriction, rotator cuff injuries. In this video, we'll dive into what the rotator cuff is, what causes injury, common symptoms, and my top 5 exercises to rehabilitate your rotator cuff. The rotator cuff is a group of 4 muscles and their tendons that surround the shoulder joint. They play a critical role in stabilizing and facilitating movement of the shoulder. To better understand rotator cuff injuries, let's take a closer look at what the shoulder anatomy is like. We'll quickly go through what the bones of the shoulder are, and we'll have a quick look at the image on the screen now. The humerus, which is the upper arm bone, forms a joint with the scapula or the shoulder blade at the ball and socket joint here. The rotator cuff muscles and tendons help keep the humerus securely in place. There are 4 muscles that make up the rotator cuff, and these are the supraspinatus, infraspinatus, subscapularis, and teres minor. They sit both at the front and the back of the scapula, or the shoulder blade, and we can see them in this image here. And so from the front view, if you're looking straight through a person, you have the subscapularis here, which sits on the front side of your shoulder blade, with the infraspinatus poking around there at the back. You get a better view of it, the infraspinatus, from the back, which is quite a big muscle here. The supraspinatus sits at the top of the shoulder blade, running over the top of the shoulder, and your teres minor sits a little bit underneath your infraspinatus. And together, they control the rotation of the humerus and stabilize it during movement. So, what causes rotator cuff injuries? Well, rotator cuff injuries can occur from overuse or repetitive motions, aging or trauma, or a combination of these factors. Repetitive overhead movements, such as those found in sports, can contribute to the wear and tear of these tendons. The rotator cuff can also be injured as a result of heavy lifting, especially with an outstretched arm, or as a result of trauma from a fall. This list is obviously not exhaustive, but if you have injured your shoulder, you might resonate with one of these reasons. Due to the nature of the rotator cuff stabilizing the head of the humerus, when the rotator cuff is injured, it loses its effectiveness. This can lead to the ball of the humerus sitting slightly off-center within the socket, or having non-optimal movement when it does spin and move. Commonly, we see the head of the humerus sitting too far forward. As a result, we see rotator cuff injuries leading to pinching of the tendons or other structures of the shoulder when there is movement, leading to conditions such as shoulder impingement or bursitis. These conditions often coincide with rotator cuff injuries, leading to increased pain of the shoulder, difficulty generating strength or lifting the shoulder, and limited range of motion. Now, let's discuss how to manage rotator cuff injuries. In the initial stages of injury, your main concern will be to reduce the pain around the shoulder through rest, anti-inflammatories, and treatment, and to regain all the range of motion of your shoulder. And this may involve resting from any aggravating activities or sports for a period of time. Exercise plays a crucial role in rehabilitation for this injury. A physiotherapist can help design a customized exercise program that can help you regain flexibility and strength of your shoulder. But I want to share with you my favorite exercises that I would give to a lot of my patients. First, we'll use a resistance band to help engage the rotator cuff muscles. This is particularly good as a warm-up exercise for the shoulders, even for those without injury. Start by lying on your back. Tie the resistance band into a loop and loop this around both your wrists, where your wristwatch would usually sit. Keep your hands clenched in a small fist with your wrists nice and straight. Have your elbows bent at 90 degrees, resting next to your body, and then gently pull on the band, engaging it to about 10 to 20%. Holding this tension, straighten your elbows up until your arms are fully straight, and then slowly lower your hands over your head while maintaining that tension the whole time. Go until your arms are starting to shake, or when you've reached the end of your available range. Then bring your arms back up until they are straight again, and bend your elbows to lower them back down. Then release the tension on the band. Repeat from the start again. You should feel the muscles at the back of your shoulder working the higher your arms go above your head. The slower you do this exercise, the more effective it will be at engaging your rotator cuff. Now, to progress the difficulty of this exercise, we can change the position in which we do it. This time we'll be in a sitting position. From there, the movements will be quite similar to the previous exercise, with the band looped over your wrist. Start with your elbows bent in front of you. Engage the band to about 10 to 20% again. From there, keeping your hands in a fist, straighten your arms up as far as you can above your head. Then, bend your elbows to come back down. You'll want to focus on controlling the change of direction with this exercise. Once again, we expect you to feel the muscles at the back of your shoulder working as you move up and down with the band. For both of these exercises, you can look at building up towards 3 sets of 10. We can also use the looped band to challenge the endurance of your rotator cuff. Stay seated and with the band around your wrist. This time, bring your arms up to 90 degrees with your elbows bent also at 90 degrees. Engage the band and hold it for 30 seconds. If you have one rotator cuff that is weaker than the other, you might feel that that side begins to burn faster than the stronger side. We can do this exercise 3 times in a row, but at least have a 30-second to a minute rest in between. The next exercise will target the rotator cuff through a series of movements done one after another. For this, we'll need a small weight. If you have recently been injured, I'd recommend starting this with either no weight or a half kilo. Start by lying on your uninjured side, with your injured arm straight by your side. Bring your arm out in front of you, keeping your elbows straight to 90 degrees, and then back to your side. Keep your wrist pointed down to the ground for this whole motion. Perform 10 repetitions of this, and on the 10th one, keep your arm held out at the 90-degree point. From there, open up your arm so that it is now perpendicular to the ground. And then lower it back down to the original position out in front of you. You'll perform this for another 10 repetitions. After 10 repetitions, bring your arm back to your side and bend your elbow to 90 degrees. Drop your hand in front of your tummy and then rotate your arm to lift your hand back up while keeping your elbow bent by your side. This will really target your external rotators of your rotator cuff. The last exercise is more so for late rehab and return to sport, specifically targeting the control of your external rotators through movement. You'll want to use a resistance band or a cable pulley for this. Hold your arm up to the side at 90 degrees with your elbow also bent at 90 degrees. Pull on the band and rotate your shoulder so that your fist is now pointed to the ceiling. From there, keeping the tension on the band or the pulley, straighten your arm up into a shoulder press and then lower it back down and then de-rotate your shoulder to finish the movement. This will work your rotator cuff in stabilizing your shoulder while you lift it up, which is great training for any sports that require overhead strength and control. The majority of these exercises target your external rotation, control, and strength, as this is commonly the weaker muscle group of the rotator cuff. Regular exercise is key to regaining function and strength of your shoulder. These exercises, when performed correctly and consistently, can help you recover and prevent future injuries. Remember that all these exercises should be performed with little to no pain. If you are experiencing symptoms or ongoing pain from a shoulder injury, please consult with a qualified healthcare professional or physiotherapist for an accurate diagnosis and customized treatment plan. If you have enjoyed this video or found the information in this video helpful for you, please hit the like button and leave me a comment down below. If you haven't already, subscribe to the channel to stay up to date on how to look after your injuries, body, and health. Thanks so much for watching, and I'll see you in the next video.